ambitious plan towards achieving universal health care coverage by the year 2022 for its entire population may be slow on its tracks, but there are counties who have made significant progress since 2013 when the devolved units came into being. My name is Dr. Masi Korir, and on this episode of Health Digest, Beldin Waliaula brings you the story of Makueni County's journey towards providing health to all its residents. Universal health care coverage is high on Kenya's development agenda, but there's still a long way to go before everyone has equal access to care. While enormous gaps remain, there are some success stories too, like in Makueni County. At Makueni Level 5 Hospital, one of the biggest health facilities in Makueni County, we meet Kizito Mulili, who has been hospitalized for over a month at the male wards after a road traffic accident.
Nikaendelea, nikakuja karekebisho, nikaendelea tena. Sasa wakaona mpaka niweko plate chuma. Sasa ndio nikakuja hapa 13th last month. Nikakuja nikaweka chuma 15th. So after the kuweka chuma, nikapigwa picha tena. Hiyo chuma ikakuwa ilikuwa mahitilafu kidogo, ilitokea kidogo katika theater. So I'm waiting for revision.
Even after this duration of time in hospital, Mulili says the treatment, including the surgery on his leg, has cost him nothing out of pocket at the point of care.
I only paid 500 for the universal health care, so the other expenses have been catered for.
He is not the only one enjoying free medical care services in Makueni. At an adjacent ward, we meet Cecilia Mulewa, who has been nursing her husband at the hospital for 4 months now. Oxygen is one of the costly medical commodities because of its scarcity, especially now during this COVID-19 period. But for Cecilia, they count themselves lucky that for the 4 months in hospital, they haven't even paid a dime for her husband's treatment. In Makueni County, everyone aged 65 years and above is accorded medical care at no cost, at point of care, regardless of their illness.
Kama hiyo kadi si ningefanya nini? Kuanzia mwezi ya 4 ni mbali sana. Mandawa, vivimo, kulala, sijui kama naweza lipa. Kwa hiyo kadi imenisaidia sana. Hii tulichukua 2019 na hapo nyuma tulikuwa tunachukua.
Tunalipanga pesa ngapi na lini?
500 ikiisha, lakini kuanzia 2019 hatuyalipa pesa.
Mwasia Muli, aged 65 years, has recently undergone surgery at the facility. While sitting barefoot on a hospital bench outside his ward, he can't fathom the fact that he paid nothing for the procedure.
Hiyo kadi inaita kadi ya kibona governor. Hiyo ndio inasimamia hiyo zingine zote. Hata operation, hata nini nasimamia. Sasa kama ile na juice sasa, ile niliona ilikuwa ndamu mara 3, alafu ni 2,500. Sio ni pesa. Hiyo kupata hiyo pesa bado ni shida. Na hiyo tu ni hizo test peke yake. Bado daktari atakupeleka theater, ni pesa kuvuka. Daktari si analipa. It's a lot of money. It's quite enabling kwa mtu ambaye hana pesa. Ni shida. Kwa hivyo kadi hiyo ya gavana kwangu mimi naona inasaidia sana.
He says the Makueni Care insurance has helped to improve health-seeking behavior among people.
Huwezi kaa nyumbani ati una pesa unakataa kwenda hospitali, hiyo itakuwa ni shauri yako. Hata kama unatoka mbali hospitali utembee ufike hospitali sababu hakuna pesa utaitishwa.
Makueni County was one of the first counties in the country to implement universal health coverage through their program Makueni Care. According to Dr. Patrick Musyoki, the county's chief officer of health services, the cover ensures every resident has access to the highest standard of curative, preventive and promotive health care.
In 2013, the poverty index in Makueni County was about 64%. And people were becoming poorer because of the very hefty hospital bills that they were incurring. And one would even have to sell their cattle, they would have to sell a piece of land. Harambes were the order of the day by politicians and so on. So 2013 we started building the health systems, strengthening our health systems. We looked at the human resource. From about 900 healthcare workers, we have scaled that up to now about 2,000 employees. Because health being a service, you must have the requisite skills of healthcare workers, well motivated to do the work. We expanded the infrastructure. We had only about 3 theaters. Now we are operating 14 theaters across the county. Most of our hospitals did not have imaging modalities. Now we have X-ray departments, ultrasounds across all our sub-county hospitals. And basically, even specialist care. We used to have very little of that. Now we have on board an orthopedic surgeon, man in our trauma center in Makindu. We also have an ENT surgeon. We have more gynecologists. So basically, ophthalmologists, dermatologists brought on board by the county. So that background of strengthening our health systems prepared us to now start thinking, this UHC that the world has been talking about, we have now the ready infrastructure to make sure that as people come, we are able to accommodate them and give them the services they need. And even at the primary healthcare space, we used to have very, very few dispensaries and health centers that were not well equipped. But now, in 2013, we had about 107 facilities. Currently, we have 236 operational health facilities, double the number we started with. And this makes our people to really access the services closer home. They don't have to go to a sub-county hospital.
It is something that the people demanded. They said one of the areas which makes them lose their land, their cattle, their investments, is the money that they pay to healthcare, particularly when they were now in the hospitals being charged. And as a result, they said for them, one of the most important things that devolution could do for them was to make healthcare very affordable. If possible, to make healthcare free. And of course, within WHO language, within even the country's policy documents, the question of universal healthcare was pertinent. So when from the people, in terms of public participation, they expressed their desire for good medical care, and if possible, free of charge, we first of all focused on the facilities, because in 2013 we had about 109 health facilities. We began to build those up, and currently there are about 237 health facilities. They have more than doubled, so that people don't have to travel long distances to access health care. We also focused on the personnel, because we found that the personnel was there are not many people, and we have more than doubled that personnel.
After improving the primary health infrastructure, the next thing was to do away with user fees the patients get charged.
Makueni had about 200,000 households in 2016, and we said we are collecting about 80 million per year in these sub-county hospitals when people come to pay. And we said if each household of the 200,000 paid 500 shillings per year, then we would already have collected 100 million, which is more than the 80 million that we were collecting. And from just that simplistic ideation, we started a pilot from 1st of May 2016 to about September, 30th of September, where we were just treating the elderly above 65 years. And you know, that is one group that has the highest burden of disease. And within that pilot period, we were able to manage all the over 65s who came to hospital without asking them to pay, and we spent about 10 million. So our projections told us already, if this high burden disease population, we are able to manage it. And of course, the children who are another cohort with high disease burden, already the services were free by the national government. So we started off from the 1st of October 2016. We scaled up, where now we invited all households to come on board. They pay 500 shillings. The over 65s don't pay, those ones are free. So anybody below 65 years, they pay 500 shillings to cover their families, the dependents and the principals for 1 year. And we've run that program since 2016 to date.
To clarify, Dr. Musyoki says Makueni Care is not in competition with NHIF, and the county encourages people to have the NHIF card so that they can access treatment outside the county, especially when they get referred to other hospitals.
The people who can afford NHIF, we continue to ask them to register, because it is a revenue source for the hospitals. And when you have NHIF, you can also be treated outside Makueni County when you're referred, like to KNH. So basically, Makueni Care is a concept that just works within our borders and in the public health sector. We cover outpatient services, we cover inpatient services, including operations, which we do in our hospitals. When one is registered with Makueni Care, they are able to benefit. And radiology services, if somebody needs to have x-rays done, the laboratory tests that are done, all that is covered by Makueni Care. And if something goes bad and a loved one dies, the first 10 days of mortuary are also covered by Makueni Care. So it is a very robust and very, very generous package, because we wanted to encourage our people to start appreciating this fact of prepayment for health. When one walks into a hospital and we are doing biometric registration, they go to the registration desk, their details are pulled up, and we know that they're part of the scheme, and they're not asked for money. They now go to the consultation rooms, and all the treatment that is covered after it happens, then the hospital keeps a record that we have seen so-and-so. He would have paid 1,000 shillings, but because in the scheme, they will not pay now at the point of service, that invoice is given to the county at the end of the month. And we have a budgetary allocation in our budget, which helps to supplement the monies that hospitals are collecting, both cash paying patients, NHIF, and any other private cover. So we reimburse the hospital that cost that the patient would have been asked to pay.
Makueni Care has also improved health-seeking behavior. Now, people are going to hospitals early to seek services compared to before.
We have also seen health indicators generally across the county improve. Our skilled birth attendance has improved from about 17% to currently about 90%. And that is really something that we are very, very proud of. If you look at something like the 4th ANC visit, it was very poor. Very few mothers would attend 4 antenatal clinics in this county consistently. But right now, we are at about 60%, up from about 15%, which really tells us our mothers are coming to our clinics, they are receiving the good care that they need to receive, and even when they come to deliver, we are delivering healthy babies. And even the Mother and Child Hospital that is just right behind us, we have seen mothers coming all the way from Nairobi to come and seek services with us here in terms of delivery. And that is something that we are also very happy about.
I remember when now old people or older people like myself, because I'm 67 now, had access to hospitals without having to pay. Many people who had been unwell and could not go to hospital began to come to hospital, and we had an influx of the older generation coming to hospital. And indeed, even some came because they were not actually very sick or sick at all, but they'd been malnourished, they had been, without food. And sometimes, we would examine them and we would tell them that actually you're not sick. But they would want to insist on staying because at least some had a regular meal, because in some situations they didn't have that.
Unfortunately, the insurance only applies to Makueni residents, and if you reside in a different county and seek services in Makueni, you will have to pay out of pocket to access the health services.
We've actually increased, for example, healthcare facilities. We've reduced walking kilometers from 10 to 5 kilometers, which really makes it easier for women who are actually healthcare providers to walk shorter distances, and therefore, in terms of helping family health, that has really done a lot of service to particularly women, because they are the service provider, they are the healthcare providers for their children, for the elderly, for the disabled. So that has really made an impact. We've been able to focus on sexual and gender-based violence. We are about the only county that has a gender recovery center in our level 4 in our referral hospital here in Makueni. It's staffed by healthcare service providers. We have a doctor, we have clinical officers, we have nurses, and then we also have a counseling unit and a counselor attached to the center. The counseling unit is in every of our 10 hospitals. We have a counselor in each of those hospitals. And for example, mental health has become an issue in this country, and therefore we are also the only county that has a counseling unit.
But one would ask, how sustainable is this program?
When each household pays 500 shillings, and of course there is the budget, the ordinary budget that we also take to the to the health services, we will be able to sustain from 2016 to sustain free medical care for our people after they have paid. The 500 shillings is usually an administration. Although we are of course thinking of revising that, because from 2016 to now it has been a long time, and even if we were to revise it, we can't take it beyond 1,000 shillings per household. So that still many people access, and this is something that we also took to the citizens, because even when we want to make that decision, it has to be approved by them. So basically, we are able to provide services even when it is operations.
This program faces challenges just like any other, as Dr. Musyoki explains.
We know that the way we've expanded our infrastructure, the way we have expanded the human resource for health, is not at the pace that we would have wished to do, because of course finances are limited. And so sometimes you find that the numbers of the people who are coming to seek health services from us, having in mind also we are getting an influx from neighboring counties, sometimes our healthcare workers are a bit overwhelmed in terms of numbers. But continuously we are recruiting more healthcare workers. Currently, the County Public Service Board is recruiting about 172 more healthcare workers. We have also had our nurses, clinic officers, some of them on contract. and we've been paying them about 40,000 per month, slightly higher than what the private sector is giving. And that has been a challenge a bit because they say we are doing the same work with those who are permanent and pensionable. How come we are paid slightly lower?
Governor Kibwana also notes that universal health coverage is more than just eliminating the out-of-pocket expenditure. It's also about ensuring access to quality health care. This means that capacity in both infrastructure and other resources are increased to meet the needs of the people.
We learned that before you can really have universal health care that one can talk about, you must look at all the parameters of your health system so that you will deliver something that is believable and that people will say, yes, this helps us. And the formula that we used was quite simple because we asked how much money do people pay in the hospitals, because even at the dispensary level, the services were free. So we said, how much money do they pay? That time, they paid about 100 million. And therefore, we said, how much should each household pay so that we recover that 100 million? And this is how we arrived at the figure of 500 shillings per household. Currently, we have 250 households. And so we began to pilot. And during our pilot, we focused on the people who are 65 years and above.
One of the things we are also very, very interested, and I'm actually, that's going to be something that I'm going to work very hard, the community health strategy, because of the increasing number of people suffering from diseases that are lifestyle. For example, high blood pressure, diabetes. So with a community health strategy, we have 3,512 community-based health volunteers, and those have mapped villages. And in those mapped villages, they are also given a smartphone where they are able to, if they find a patient that the high blood sugars, they have high blood sugars, they are able to report to the nearest health center or to the nearest facility so that that person is actually supported.
Besides, Makueni has a mother and child hospital fully dedicated to handling women and children. This has helped ease congestion at the main hospital and ensure women and children get the ideal care that they need. The nurse in charge takes us to the post-delivery wards, which are clean and well aerated, with mothers, especially those who have delivered through the cesarean section, getting personalized treatment. With the care they get here, including meals, it costs nothing as long as the mother is enrolled in the Makueni insurance scheme. More than 300 deliveries are recorded here every month.
All our sub-county hospitals, 10 of them, we have Kibwezi Sub-County Hospital, we have Kambu, we have Makindu, we have Tawa, we have Kisau, we have Matiliku, we have Sultan. All of them are registering continuously clients for Makueni Care. And at the county referral hospital, we are also doing the same.
To those in Makueni County and have not registered on Makueni Care, the county bosses encourages them to do so. Universal health coverage is fundamental to ensuring social protection for health. Building Waliaula KTN News.